Greetings and welcome to your destination. You've reached the Psychological Wellness Hub. We aim to help you build your knowledge and wellness around better understanding mental health and psychological concepts. Welcome back to the channel. Today's topic is geared towards answering this question. What are sanitariums and state forensic treatment facilities? Remember to stick around to the end of the video to get more answers and where to go next or the next steps. Quick review, a basic understanding of the levels of mental health treatment. Mental health and substance misuse levels involve different forms or types of treatment that have different approaches and intensities. It involves a professional relationship between a behavioral health or mental health provider with a patient, client, or consumer. The relationship is agreed upon one where the mental health provider and the patient work together using the treatments in different settings or types of locations as a mechanism or portal to reach the patient's, client's, or consumer's goals. In some cases, the patient, client, or consumer may be ordered to undergo mental health or substance misuse or addiction treatment in one of these settings. In this case, it may involve a setting inside where there are restrictions in access and independence, or outside settings where there are consequences associated with not following through with the treatment. Generally, the consequences involve legal or forensic systems enforcing them. Quick review. What do we mean when we say treatment settings or locations for mental health and substance misuse treatment? Each level or setting is backed by research to show its effectiveness, like psychotherapy and psychiatry or mental health medication treatments. Levels go from more intense and restrictive to less intense and restrictive. Some patients, clients, or consumers go voluntarily to these facilities. Some go involuntary due to judges ordering them and sustaining a mental health hold or commitment. Some go as ordered by a judge as a result of the legal implications as well as the mental health condition. Please look for videos on the level of mental health and substance misuse in the description below or on the channel. It may serve you to watch that video first and return to this video. What is a sanitarium or state forensic treatment facility? These are considered the most intensive or restrictive treatment settings. This is usually things like state forensic hospitals or sanitariums through the legal system. Depending on the severity of the crime and the availability of the conditions of the mental health treatment at the penitentiary, one may have to go to facilities such as this. Sanitariums or state forensic hospital treatment settings always involve inmates who have been involved in the legal system as part of the conditions of their incarceration, including some or all of their time in a setting like this. These are generally state-funded institutions. They are like a state hospital and a high-level penitentiary combined together, sometimes referred to as asylums. The focus is on containment and treatment of the condition that was determined to have been involved in some way with a legal issue. Staff generally include prison guards, nurses, psychiatrists, and orderlies whom work with these units. Sanitariums and asylums generally will allow inmates restricted access to rooms and the ability to move about. This generally involves a level system where the inmate may show improvements over time and obtain more privileges to move about the facility more. Inmates generally have prison cells or secure rooms. There are generally treatment day rooms and other treatment areas that are secure, including nursing stations and consultation rooms. Inmates may have very limited access to supplies and other things. This is so they cannot be turned into forms of weapons or used against others or themselves. These settings use mental health medications, forensic structure, and sometimes access to group or psychotherapy treatment. They also sometimes have access to recreational and occupational opportunities and interventions depending on the severity level of the institution. To picture this type of setting, you may consider the movies. Keep an eye out for videos related to this. How do I learn more about each of these treatment settings? We will talk about this and more in future videos. Feel free to check out the channel to watch more videos on these topics and how you can make the best use of them should you choose to do so. We hope you found today's topic was useful for yourself or someone else. Let us know if it was by commenting below. Let us know what you'd like to hear about or what topics could be useful to you by commenting below, and we'll take it under consideration. If you like what you heard today and would like to hear more from Destination Psychological Wellness Hub, please consider liking, subscribing, and following the channel or the page. This will help you get the newest content produced by the channel to you. Please tell all your friends and family about this channel or share this and other videos with them on this channel. Encourage them too to like and subscribe. And as always, we hope your psychological wellness continues to grow with us in this community. Thank you.